Yes, hello and welcome to Community Health Worker Vaccine and COVID Resources you've been looking for. Envision's second monthly training webinar. For those of you who are new to joining this group, Envision is a collaboration of CHWs and CHW allies who work together with financial and administrative support from the Centers for Disease Control and Prevention to elevate the role of CHWs. I'm grateful for the opportunity to be in community with each of you today. My name is Andrea Hayward, and I am a community health worker. I serve as the director of the Community Health Worker Institute at the Center for Community Health Alignment. We are so excited to have the opportunity to be a part of the Envision team and to work alongside each of you. We will now hear from Dr. Sherry Johnson, Director of the Population Health Institute, the coordinating organization for Envision Equitable Healthy Communities Training and Technical Assistance Center.
Thank you for that introduction. I just wanted to introduce myself and say that we at the UW Population Health Institute are really grateful to be working alongside all of you and to bring the passion and assets and values that we have at the Institute to bear on this important work. I am an ally, not a community health worker. My background is...
It has noise canceling. Yeah, and they're not super expensive.
Oh, I'm sorry. Was that for me to wear noise canceling headphones? Can you hear me?
Sherry, you're good. Keep going, please.
Okay. Everyone, I was just going to say that I am a community health worker ally, and I've had the chance to work alongside community health workers in the context of federally qualified health centers, both in Milwaukee and Boston. I'm a Milwaukee native and continue to live there. And just wanted to share that the Institute has a vision of working together toward a world in which we value each other, honor our connectedness, and build communities where everyone can thrive. And our values include collaboration and courage. And so we are just really grateful to be in the space with you and look forward to bringing whatever assets we can to the work. So thank you for welcoming me.
Thank you so much, Dr. Johnson. So for our agenda today, which is on the screen, we will cover CDC COVID updates, provide you with some Envision news, NACHW CHW network and COVID resources, vaccine equity, collaborative strategies and materials, and have some time for a question and answer session. Please note that this is the second Envision webinar. For access to the first webinar, Playbook on Advancing CHW Engagement in COVID-19, you can access that in AMP. So as we proceed with today's webinar, please feel free to utilize the chat for questions, comments, and a member of our team will be available to answer any immediate needs and capture additional questions that we'll answer after. And now I'd like to the first being that Envision is hiring. These positions are in our newsletter that we send out. So if you have not opted into that, please be sure to do so and share. Also, thank you to those who completed the rapid assessment. Please know that the resource materials are in the mail and will be arriving soon. Also, before we hand over to Aurora from NACHW, we just want to thank NACHW. They truly are a premier source for CHW relevant, up-to-date COVID information. The NACHW newsletter does a really amazing job of gathering and disseminating timely information for use in community outreach and education. And so with that, we will now turn it over to NACHW to start today's discussion.
Thank you so much, Andrea, and thank the whole Envision team for helping to put on this webinar today. My name is Aurora Graham-Wingate, and I'm here to represent the National Association of Community Health Workers, or NACHW. You can go to the next slide, please. And I'm also, during my presentation today, going to talk a little bit about the new testing resources that are coming out for community health workers and for communities. Next slide, please. Before I get into that, I want to talk a little bit about NACHW as a whole. Firstly, NACHW uses community health worker as an umbrella term for the many different titles that community health workers hold, such as promotora de salud, community health representative, outreach worker, and so many more. NACHW is a fairly new organization. We're coming up on our third year after many decades of CHWs from across the country looking for a central unifying body to further professional identity, advocacy, and promote our ideals of social justice and self-determination. We are first and foremost a membership organization. We're very proud to say that we now have membership across all 50 states and many of the US territories. I also want to encourage you all today, of course, to stay connected to us. We would love to stay connected to you and what you are doing, but also to get connected to your local state or county CHW association. On our website, which I'm going to drop in the chat, you can find a list of local CHW associations. Many different states have them, and it's a great way to get connected to other CHWs and get connected to their resources. Next slide, please. Since the onset of the pandemic, NACHW has been working with CHWs from across the country to try to meet their needs as they serve on the front lines of the COVID-19 pandemic. We have helped co-found 2 different organizations, one being the Community-Based Workforce Alliance, and another, which you'll hear much more about today, the Vaccine Equity Cooperative, or VEC. We also had the pleasure of getting to work with the Rockefeller Foundation on their U.S. Equitable Vaccine Impact Strategy. And as you can see, this is at the bottom what we are here doing today, working with you because of the 2109 CDC grant process. Next slide, please. So now I want to talk a little bit about this White House testing initiative. As I've said, since the beginning of the pandemic, CHWs have been on the front lines of the pandemic response, and we at NACHW want to be advocating and providing the most up-to-date education around what resources are available to community health workers. And with that, we have been working with the White House to get this information into the hands of community health workers as quickly as possible. Next slide, please.
Hey, Aurora, this is Sherry.
Yes.
With Envision. The interpreter is asking, could you please slow down a little bit so that you can keep up with the Spanish language interpreting? Thank you.
Definitely, no problem. So as many of you may have heard earlier in this month, we have heard that the Biden administration has committed to sending out 500 million COVID-19 self-tests to residential addresses. That program is now live. And is at covidtests.gov. I'll also put that in the chat. I encourage all of you to get your test kits today, and I'll talk a little bit more later in my presentation about how to do that. Next slide, please. These slides are available on our website, and you can learn more about this rollout in these slides here. Next slide, please. As I mentioned, right now, anyone in the US can go to covidtests.gov and order a free COVID-19 test kit with 4 COVID-19 tests. We know in some ways this is a limited initiative and that many folks will not be able to get these tests, but for folks who are able to, we highly encourage community health workers and their clients to get these tests to help with the preventative strategies around COVID. Since for the last several days, NACHW has been working to educate community health workers across the country about this launch. You can find more education and resources about that at nachwa.org/COVID-tests. Also on that website, you can sign up with us to receive more information about future COVID-19 resources and opportunities. Next slide, please. We also really encourage you to share this and other opportunities with your community and through social media. You can also find on our website some social media toolkits to help you share this opportunity. NACHW also knows that community health workers have more and greater needs around COVID, that there is greater need for access to at-home tests and KN95 masks. Also on our website, we're asking for some feedback on what community health workers need in that area so we can better advocate for you. Next slide, please. To help educate around these initiatives and opportunities, NACHW has created various different resources that you can find on our website. We have our webpage translated into 3 languages. We have email messaging, We also have FAQs about this government program in English and Spanish. We also have a telehealth community navigation center through Dia de la Mujer Latina, which I'll talk about more in a few minutes. I'll also spend some time talking about some one-pagers we are offering out to communities to help educate about this opportunity. Next slide, please. And here it is. So the Telehealth Community Navigation Center is run by Dia de la Mujer Latina. It is a national call center for debunking miscommunication, reducing mistrust, and providing navigating services for communities all across the country. This call center is manned by promotoras and community health workers in Texas. It is a bilingual helpline available in English and Spanish, and is a great resource to help community members get signed up for this vaccine program and to get connected to vaccines and tests more widely in their communities. Next slide, please. And also, we know that these 4 tests will not be enough for all different communities. So we want to share some other opportunities folks have to get free testing. One of which is the new opportunity that the Biden administration recently announced, that folks with private health insurance can now get up to 8 tests per month per person with insurance if they are able to find tests at their local pharmacy. This also applies to Medicaid and CHIP, and you can check out your local state regulation around those rules. You can also find a community-based free testing site, and there is a link on this flyer to also take you to that site. You can put in your location and they will show you the nearest testing site. We also have this new program called Operation Expanding Testing out of the CDC for various different organizations that may qualify to become a free testing center. I'll also put some of these links in the chat. And as I said, all these slides are going to be sent out to you. Yes, and Monica, I see Monica saying in the chat, and I will be dropping these in the chat as we go. Next slide, please. And this is just a general handout that you can also use about the opportunity that the White House is putting on right now, how to get these test kits. Next slide, please. For this and more information, you can visit our website at nachw.org/COVID-test. If folks have questions, I will be in the chat for the rest of the presentation. I'll also put NACHW's email address in the chat. Thank you so much for having us here today, and thank you for everyone on the call for all the hard work you're doing in the COVID pandemic. I'm going to hand it back to Andrea now to take us into our panel.
Before we get to our panel, thank you, Aurora. Lots of information, and I'm going to make sure I note those chats after my talk today. Hi, everyone. My name is Tanae Franklin, and I'm the Vice President of Health Equity and Stakeholder Engagement with Health Leads, and I'm also a member of the Vaccine Equity Cooperative. I bring you greetings from Nashville, Tennessee, where it is an icy day outside and with no snow, but schools are closed. And also, I just wanted to give you an idea of a couple of other hats and perspectives that I'm coming from today as we have our conversation around COVID and vaccines. I'm also on the Board of Health in my local health department, and I'm also the Tennessee NAACP State Health Committee Chair. So I understand, I'm also an ally, just like a previous speaker, and I understand the work that you do. And I just want to say thank you for being on the ground in the trenches. We couldn't do this work without you. Next slide, please. So I want to share a little bit about the Vaccine Equity Cooperative. Our aim is to take what we understand about racial inequities and try to find a path forward to overcome those racial inequities. We know that because of historical inequities, our approach to the pandemic and the impact of the pandemic on the communities across the United States and actually across the world still is an opportunity for us to improve. And so we look to those solutions that we're learning now to document those to better address those future crises. Our work is organized in 3 distinct areas. First, we know in order to really understand the problem, we need to understand the data. And so we are advocating to make sure, and we're pulling together and curating, helping to curate data so we can be informed of the lay of the land with regards to the pandemic and vaccines specifically. In addition to that, we want to make sure that we provide access to trusted resources and best practices, and also promising practices. We also convene and collaborate and facilitate learnings with different groups, from government agencies to community organizations, to better expand funding and support local community-based organizations. And we do this also through advocacy, capacity building locally, which includes strengthening policy to support community-based and public health workforces. Next slide, please. This slide gives you an idea of the myriad of partners that we have. NACHW is one of our significant partners that we've been working with closely this week, specifically with regards to the COVID tests rollout. However, we do have partners that are advocacy organizations, other nonprofits, and philanthropy. And the beautiful perspective that these organizations and the individuals that represent these organizations bring to the table is that they have one foot in practice in their local communities, and also one foot in spread with regards to helping to frame the larger issue and strategy for how we're addressing vaccine equity here in the United States. There are leaders and practitioners from communities that are most impacted by COVID, from rural communities to communities in the deep South to our urban cores. And our agencies, our stakeholders that are part of the cooperative have decades of experience leading health equity programs. We also are fortunate enough to have global perspectives with regards to vaccine hesitancy and research that helps inform the work that we're doing. So in the right column, I just want you to take a look at those numbers. And at the end of the day, the take-home message that I want us to sort of focus on is that we have a vast reach across the United States. But we know that it's not just federal government and state, it's hyper-local activities with our municipal governments that are going to help get us over the hump and get us where we need to go in our local communities with educating our communities and grassroots individuals about COVID and the vaccines. Next slide, please. So on this slide, and I'm hoping I'm going to drop this in the chat, the Vaccine Equity Cooperative is a resource hub for information that we hope that will help you as you work in your communities to garner ideas with regards to strategies and toolkits and information and resources to help move your work forward. We have our resources organized by target population and also by specific topics within vaccine equity. And the beautiful thing about the Resource Hub is that it's sourced from the work that is being done across the country on the ground from individuals just like you. And probably some of you, I would hazard a guess, if we were to go through the Resource Hub, you would probably be familiar with some efforts in your own backyard. But we need your help. We still are looking for ideas and better understanding what's working in different parts of the country. What are the partnerships that are working? So we invite you to visit vaccineequitycooperative.org and submit your ideas and bodies of work. And we're happy to communicate with you as well so we can learn a little bit more. Next slide. So with regards to advocacy, advocacy is huge. And when we think about advocacy, it's not just advocating from the perspective overarching and sort of what the stakeholders from the Vaccine Equity Cooperative think we should be advocating for. We are consistently gathering information, feedback from our community partners, from individuals that we know in local communities that we're working with even outside of our 9-to-5s to help inform our advocacy strategy. So this is updated I would say weekly. We have so many meetings with regards to stakeholders on the ground. And so our advocacy efforts are only as good as the information that we receive from folks on the ground like you all. So thank you for lifting those ideas up and lifting up that feedback, and please continue to do so with the Vaccine Equity Cooperative, with NACHW and other organizations like that. With regards to our advocacy efforts, our goal is to increase investments and to improve funding systems and processes for community-based organizations. You'll probably hear a little bit about that when we have our Q&A. Strengthen and sustain community-based workforces, and also build better, connected, and transparent public health data infrastructure. Next slide, please. So what is needed right now, and what are we working on right now? Protecting children under 12. And I know a lot of us have children in our lives under the age of 12, particularly under the age of 5, are not able to get vaccinated. But even those that are 5 to 11 and the older kids from 12 to 18, there's still some work to be done with understanding how we do that. So within the VEC, or the Vaccine Cooperative umbrella of organizations, we have also championed, a group has come together to focus on children's vaccines. And we were able to come together with the expertise to author the recommendations that you see in front of you. And I'm actually going to drop the link to the recommendations in the chat as well, so you can take a look at that a little bit more closely. The recommendations with regards to children's vaccines are rooted in racial health equity. We prioritize outreach in the context of whole families and communities, not just the individual student in school. We also build on existing proven infrastructure with a no wrongdoer approach. We engage all sectors across health policy, communities, schools, and the private sector. Essentially, what we know about focusing on children under 12 right now with regards to vaccines is that it is all hands on deck. And so this is, we are fortunate enough to be able to provide these recommendations, but the work does not stop there. So we still need to better understand what's working in different communities on the ground, and how these recommendations are being adopted or being perceived, and if there are any questions or if we can strengthen them. So that gives you an idea of where we are right now. Everything that we do under the Vaccine Equity Cooperative is rooted in racial health equity, because we know that data tells us that vulnerable populations are disproportionately affected. And so we're going to keep on keeping on, but we need to understand from your perspective what works, what doesn't work. And thank you for being willing to lift up those ideas and that feedback for us to all continue to work together. I will stop there and I will pass it back, I believe, to you, Andrea.
Yes, thank you so much. That was such great information. The Vaccine Equity Collaborative is doing some really it's doing some really dynamic work. And now we will start our panel. We do have our moderator, Alexandra Quinn, who will introduce our panelists, and we'll go forth from there.
Hello, everyone. I think some of us on the West Coast are still in the morning. I can still say good morning and afternoon across multiple time zones. My name is Alexandra Quinn. I have a few roles. One of them is the CEO of Health Leads. Like today, I'm a member of the Vaccine Equity Cooperative. I'm a community health worker and basically moonlight as one, but did spend 6 months at the vaccine call center for the San Francisco Department of Public Health. So as it relates to this, I would be in these kind of big meetings with Scott and Tanae and Venus and Karen and others. And then on Fridays, I would get the 10,000 questions about what parental consent actually meant, because 3 different clinics interpreted in 3 different ways. And so, like many of you, kind of live this dual world of what actually happens on the ground and how that's created. And that's a lot of what I really appreciate about all of our panelists today. They all have this one foot in deeply rooted in community practice, and this one foot rooted in like, how do we actually change the systems and think about how we can better enable and support and invest in community health workers to lead and design. So that's the kind of tenor we're going to take into this panel. I would love for you all to drop in questions. There are no silly questions. There are no questions that are too big, too small. COVID, vaccine equity. We have a great group. So I'm going to hand it off to our first panelist. We have 4 panelists: Scott, Venus, Karen, Tanae. Each one brings a slightly different perspective. So first, I'd love to hand it off to each one of them to do some introductions. And I'm going to first hand it to Dr. Scott Ratson, who talk a little bit about his work and then a little bit about vaccine hesitancy too.
Great, and hello everyone, morning, afternoon. I'm Scott Ratson and really happy to be here today and hopefully give you some ideas and some examples from different orientations as I've been engaged in this space for quite some time. I'm based in a community health and social science department at the CUNY School of Public Health and Health Policy in New York. We have a health communication for social change program and have been doing a variety of surveys, both local with our Harlem Health Initiative, national and global. And I would just like to go through a few ideas as I've been thinking about this for a while. The fundamental element that I think brings us all together, and again, thanking the Envision team and today's great presentation, Aurora, as well, is that we're interested in advancing both community, and community has the same root as communication. And that means we need to have better communication and better ways that we can both build fundamental change. So with that, I had a couple of slides that I may show now, but we have oriented in looking at vaccine hesitancy that actually, frankly, was first discussed about 10 years ago. And we looked at it when we were looking at the measles challenges. And then later when COVID hit, we anticipated that similarly this would happen here in the United States. And sure enough, despite what some of our experts have said, and I have quotes, whether it be from Tom Frieden saying that it was just an element of the media bringing up the issue, basically saying that it was a good story, hesitancy, to President Biden thinking that hesitancy wouldn't make a difference, that people would all line up, to I think where we are today, in that we have about a third of Americans that are not fully vaccinated, and we also have other challenges of how we address the hesitant population. So I have a few slides that here, and one just Convince USA, and Convince actually stands for New Vaccine Information, Communication, and Engagement. And as we go through just quickly, the data is difficult, and we are a database group. So the next slide just shows where we are with finding the data, and we've been doing that with surveys and qualitative research. Right now, we're asking vaccine hesitant populations throughout the United States in English and in Spanish of why they're hesitant and how we can overcome that. The next 2 slides just show some of the quotes that I mentioned. One that Tom Frieden reminded us last May, this is a bigger problem. It's not hesitancy, it's access. And at that point, you may recall, we didn't have great access, and people might argue we still don't have access like we should have, particularly for boosters and amongst our childhood population. The next slide just shows that, as much as I are totally supportive of what's happening in this administration, people were not showing up like the president and his team had wanted. And now, unfortunately, we have vaccine hesitancy that is real. But we looked at a population, the next slide shows that we shouldn't just call people hesitant and give up. And this was an article we published in the New England Journal of Medicine. And what you can see here, this is in May of last year, that only 40% of people were vaccinated. Of this is 140,000 people in, frankly, the Ascension health system. So it might have even been different in different systems, but we published this one. And what we found is what everybody we're calling in the press, so all these hesitant people, we won't be able to vaccinate them, but they were ready. The blue group still are these vaccine ready folks. And I believe what we have today is we have transformed the vaccine ready, some of them in the vaccinated, but we still have this neutral group that are the ones that I think we can still move. And that's where we also came up with this next framing, which is just the next slide, that we think that a way that all of you might consider this is listening to the audience, which is the red there, trying to understand directly from different audiences of all levels of education, background, race, ethnicity, etc. And then try to be creative with some of the yellow approaches that we've come up with, and many of you have looked at, whether they're faith-based community, meeting people where they are. But more importantly, what we also found is partnership was key. And let me again congratulate Alexandra, not only for the Health Leads work, but the Vaccine Equity Cooperative of bringing different sectors together, because that's really what we need. And I think all of you hopefully can embrace that. And the next two slides, I'll just give some resources that I think might be helpful. We have framed vaccine literacy as an area like health literacy was in originally, frankly, in 1999, later incorporated in HHS in 2001, and later incorporated into the Affordable Care Act. I was involved with all of that early on, and the same person I did that with, Ruth Parker at Grady in Atlanta, we came up with this whole idea of vaccine literacy and have both defining it and writing about it. And I don't want to make this sound academic, but all of the work that many of you are doing will fall into these different areas, and how we can do more of it, not only, as Tanae well mentioned, advancing prudent policy, everything from the local level to the school level, to the national level, to the state level, as well as the education efforts that all of you do. And we're trying to put this into action. And my final slide will show how we're doing this in New York. We've been funded by a few foundations at the CUNY School of Public Health to put a New York vaccine literacy campaign together. And the information's all there that I just put in the chat. But basically, we've measured in an ongoing way what we think is vaccine literacy for amongst the not only 8 million New York City citizens, but also in the lower 8 counties. And we've come up with some of these tools that are there that you can see in the chat and the slides. We also have come up with an interactive dashboard, so you can actually look to see, okay, what are people thinking about vaccines? We're actually mirroring that with the city or the state data, and we think that might help people come up with creative approaches. We're not giving all of the approaches, but here are some that you can customize, for example, for parents, for healthcare workers, for employers, and so forth. But this is ongoing, and we're trying to learn from other communities as well, and are willing to share all of them. So I'll put my also contact info, and our team's info will be helpful, and hopefully, whether it's in this panel and beyond, we'll have the opportunity to advance efforts. So thank you. Sorry for maybe a little hiccup on my speedy presentation here.
Thanks, Scott. All right, and next we're going to go to Venus Ginnis from Dia de la Mujer. She has been working closely with the Vaccine Equity Cooperative, but just deeply appreciate Venus's very large tent that she invites us all into, both to learn and help support not only the community she works directly with, but across the country. So Venus, always happy to get to be on a panel with you.
Yes, saludos, greetings everyone. I am really excited to be part of this panel. Can we start with the first slide, please? So as you can see, our footprint is in all of these places. I don't know, did I lose?
We can hear you.
Okay. All right, sorry. So I'm sorry, somehow I lost. Okay, there you go. Our footprint is in 40 states and in Puerto Rico, Dominican Republic. And in 2019, our promotora training was incorporated at the University of Baja California Sur in Mexico. And as you can see from here, this is my favorite topic because I love the work of the community health workers and promotoras. We've been doing this for 25 years, since 1997, when we launched our first Health Fiesta. And as you can see from the pictures, these are all the types of trainings that our community health worker and promotoras are engaged in. And in Texas, it's a certified training program. So all of our training needs to go through a rigorous review of the state of Texas Department of State Health Services. And our training is in Spanish and English. So we have, we abide by the 8 core competencies. So communication skills, interpersonal skills, advocacy skills, organization, service coordination, knowledge base, that these are important core competencies. And I am just, like I said, amazed at the level of expertise from our promoters and community health workers. In fact, I've learned so much from them. As you also can see, that we already had embarked on a couple because of COVID. Actually, before COVID, it was Zika. We had already embarked on a emergency preparation training to be prepared in case anything like this happens. We also have been working with community health centers, and we have promotoras and community health workers now that are employed in all of these sectors, and especially now with our research team, especially at Baylor College of Medicine. So next slide. So one of the things that we did is we figured, okay, in February 2020, we heard the mumbling and what was going on in China, and I developed the first training with my friend and partner and instructor, Robin Carlisle. And we developed the training for dispelling myths about COVID-19, only because we felt like this is going to be another Zika. We never imagined that it was going to be a pandemic. So it was approved by the state of Texas on February 24th, and we started training our instructors. We have 12 instructors throughout the state of Texas. And then we had a March 5th webinar, and we left it there for 2 weeks, and we had over 3,000 people. We realized then that there was an interest in this, and we continued to expand their role as community health workers and promotoras in looking at behavioral health. So we developed the training on Behavioral Health Community Navigator, where we looked at depression, stigma, anxiety, and stress, addressing COVID disparities. And then in April, we started to have eight hotlines, and we started hearing all of the stories from the people in our community, our Latino community. And for this reason, we then developed this Vaccination Community Navigator training. This training is a 7.5-hour training that was approved by the state as evidence-based. Now this training brings us from the beginning. So it's the past, present, and future of vaccination. So it's not solely on COVID, but it shows that the history of the anti-vaccine movement. It also shows how you can advocate for better resources for our community. And then toward the end, we are addressing social determinants of health. And I have been saying this for the longest time. It's not just access. We've been wanting to address social determinants of health to eliminate health disparities for decades. And every time I would go to a conference, it was always about health disparities. But we never got to a point where we really addressed them. And with COVID, we realized that one of the issues with social determinants of health is transportation. A lot of people couldn't get to these sites. Economic development. Some of the people that were working lost their jobs. Some of them that were essential workers, had to work, and then they were, they had no other choice. They had to be part of the mainstream. They didn't have the luxury of staying home. And then there's the education piece. So it goes on and on, but we still have not addressed the social determinants of health when it comes to addressing hyperdisparities with COVID. So this training is very comprehensive. Just to give you an example, we had 406 of our instructors, because this training was just first for the instructors. So we did a train the trainer. We only had enough space for 211. And so we actually ended up training these trainers. And now in a couple of weeks, we'll train all of the community health workers. And then after that, in February, we'll open this up to everyone here in the United States and abroad. So next slide. So getting back to what these amazing promotores and community health workers do, this is just to give you an example. In April of 2020, we started the 10 hotlines. As you can see, we had the flyers going out. We're here for you. And we started the program Hablando Entre Nos, which ended up being in the same year, our Saturday live, Facebook Live program, where we actually bring everybody up to date. And these are for our promotoras and community health workers, but now we're starting to get people joining in that are not. And we welcome anyone who wants to, but what we do in our Hablando Entre Nos is we start with what's in the news. And Leslie, the one on the top left side, she just retired from Univision. She was a producer. And she is actually very dedicated to this program. The person right below her is an attorney, and these are two of my board members, and they are very committed to the Hablando Entre Nos program. So not only do they start with what's in the news to debunk misinformation, because that's what we want to do first, then they go right into the topic. And for this reason, we have Dr. Flo Muñez from Baylor. She's the one that's bringing us up to date almost every week on what's going on with the vaccines and with COVID. And then finally, in April of 2021, we launched our telehealth community navigations call center. It's actually a place where people can call. We have the lines are in Spanish and English, and we have a nurse navigator to take on the clinical questions, and they're all bilingual. So our work here is far from being done. We're looking at other opportunities for us to expand the role of community health workers. I think we have one more slide. So getting back to this training, I think something happened here, but anyway, I'm sorry. Getting back to this training, this was a training, a labor of love for our community health workers to understand a little bit more about COVID-19. And we appreciate the partnership of Vaccinate Your Family, because when I started to think about putting something like this together, I could not do this alone, because my area of expertise had been cancer, being a cancer survivor and having a sister who died of cervical cancer. My work over the years has always been on cancer. And then when this happened, we realized that we've got to show our trusted members of the community that they have a resource, and that's who we are. We are resources to our community health workers and promotores. The Telehealth Community Navigation Center, I think we have one more slide. Oh, that just shows the numbers of people from the state who took the training. This was just really Texas only, but the next slide. We have one more slide. There you go, thank you, that last one. So I was fortunate enough, I'm sorry, the slide before. Okay, there you go. So when Denise called me and said we've got this opportunity, I said, sign me up, we'll help you. And so I called on our promotores and community health workers. I said, I gotta put some of you to work because we need this for our community. So on January 17th, we had them all ready and trained to begin with the telehealth community navigation call center and get some of the folks in our community who don't have Wi-Fi, who don't have the internet capability, to go ahead and use our site to get their kits. Of course, we had just in 2 days, we had 2,484. So we haven't even looked at today's count, but just in those 2 days, we had these calls. And as you can see, where the people were calling from, we have people calling from Hawaii, California, everywhere, including Puerto Rico. In fact, some of the people that were calling from Puerto Rico were telling us that they really needed more help there. And I applaud the small organizations that are in Puerto Rico that are really struggling because they're not getting the funding and the recognition that they deserve for their work. So I think I'll leave it there and open up for questions later.
Thank you, Venus. All right, next we're going to turn it to Kara, and I may butcher your last name, so tell me if you do. Romanek from Made to Save, who's going to talk a little bit about the Made to Save resources.
Great, thanks so much. Hey everybody, you got it right, Alex. It's Kara Romanek. I'm the Vice President of Program at Made to Save. I am based in New Orleans, Louisiana, but Made to Save is a national grassroots coalition, and we have been around since March of 2021. We are a fairly short campaign, and our purpose is to ensure that there's equity in the rollout of the COVID vaccines. We are a coalition that's made up of partners from across the country, as well as from both public health and from the grassroots, from community-based organizations and civic engagement. And we really saw ourselves as kind of a nexus between those who are experts in doing outreach work and the health experts to come together as trusted messengers around the vaccines. My role is with the program team. So we have worked with now 108 community partners and grantees, specifically in 23 states. And we prioritize states where communities of color had been disproportionately impacted by COVID-19, and where we could sort of anticipate that there were going to be challenges in vaccine uptake in terms of them being particularly rural, some of the social determinants of health that were already mentioned, as well as just like a lack of access to public health resources in a long-term way. And we've been working with community-based organizations, some of whom have done a lot of COVID work in the past, some of whom are community health workers and promotorists, and then some of whom are much more experienced in the civic engagement space. And so that's the world that I come from, and we worked with groups that had done voter registration, census work, that were really seen as trusted messengers in their communities, but hadn't necessarily engaged around public health and around vaccinations in the past. So a lot of what we've done at Made to Save is to provide up-to-date health information for them, to support around data-informed messaging, and to provide resources so that groups on the ground who are trusted in their communities have what they need to have ongoing vaccine conversations. I'll talk about like 3 lessons learned and then give you a few resources. Sorry, I don't have slides. So one lesson that we've learned is just that in language and culturally relevant messages and resources are essential for vaccine uptake. We have partners that work in 17 different languages, and a lot of the work that we do at the national level is making sure that we have translated our resources, or that we are sharing translated resources with our partners. We've also found that while some of the early access issues have gone down, there are still ongoing access issues for rural communities, for tribal communities, and that it's really essential around equity to address ongoing access issues for communities to access the vaccine. And then the last thing I'll say on that is that trusted messengers means a lot of things, and we have invested, especially in this last 6 months, around lifting up partnerships with trusted messengers in schools, with employers who are trusted in many communities, although not all, as well as with creating partnerships between our community partners, or strengthening partnerships between community partners and healthcare providers as additional trusted individuals around vaccination and health. And then I wanted to share a few resources. So one of them is we have a bi-weekly grassroots activation call where our whole coalition comes together at the national level. Tanae and Alex have both been on this call, as well as maybe some others here. And this is an opportunity to share best practices, to share generally any programming or announcements. And this is also where we provide or bring on guest speakers to provide up-to-date public health information, state of the pandemic information, and data on messaging and vaccines, et cetera. So I'm going to, after I stop talking, I've put a few resources into the chat, so just hold tight. And then I would say our website is a great place to go for both resources and to get involved. You can click like, I want to share vaccine information, and you get all of our trainings. And then lastly, we launched a Vaccines at Work campaign where our community-based organizations are supported to do outreach to the business community, and then we are providing, in partnership with Health Action Alliance, we're providing resources and trainings for employers to think about COVID safety and vaccinations in the workplace. So in a second, I'll put all of that into the chat. Very grateful to be here, and so I have so much gratitude for your work on the ground.
Thanks, Kara. All right, I'm going to turn it back over to Tanae. You heard a little intro about her, and then Tanae, I think, you know, a lot of what the conversations we have are about and would love for everybody to drop in questions or just how can we support you, because so much of whether it be vaccines, whether it be diabetes, whether it be social determinants of health is about who is trusted in your community that you can have a conversation with. And since this is about how do we better invest in and embed and support community health workers and promotorial programs on the ground, would love to hear two things, Tanae. One, we just introduced a bunch of resources. How do you think about that with your Board of Health hat on and your local hat on? And then in terms of vaccine hesitancy, and Scott, I know you have some thoughts on this too, would love to hear just your thoughts on how you think about hesitancy versus institutional trustworthiness, as we sometimes talk about.
Thank you, Alex. I'll start with the first part of your question, wearing my Board of Health hat. So being on the Board of Health, I'm actually chair, and I'm not in the day-to-day in the public health department, but I will say this, and we have a well-resourced health department that overall is moving in the direction of addressing health equity. Not there yet, but we know that it needs to be done. And we have allies in the department that are doing that. And that being said, when it comes to the pandemic, even now, even when the numbers had dropped, it was still a heavy lift for the public health workforce, as well resourced as they are to be able to execute messaging, understanding and engaging with community. And it was hard to do that well. What the health department did do well was help to organize the pop-up clinics when the community told us where we needed to put them. But in terms of navigating the on-the-ground relationships and having that intel to help drive the strategy, that's where we needed help. And so to that end, we relied on community health workers in Nashville to help read that bridge to the community. So I would say this about the resources. The resources are excellent. But what it's going to take is grassroots community members sort of holding public health accountable to help introduce those resources and ask, what will it take? How can we help champion making sure that these resources and these strategies for on the ground that we know work in communities, what will it take to make sure that happens? I will tell you that the target for that conversation is not just the public health department, but a lot of times it's going to be your local mayors and city council persons. And we know, especially here in Tennessee, that the state we have a supermajority, and the state has a lot of influence in what happens on the ground. So I would even offer to lift up, take the resources that you're learning about and also talk to them with your state health departments. Because that's where we have to come at this from all different directions, and that's where it hits the road. With regards to, Alex, the question about vaccine hesitancy, Scott, when you were talking, I was just thinking about this one effort that's still ongoing, that's still being created. There is a physician here in Nashville at Meharry Medical College. Her name is Dr. Jennifer Irves, and she does research on health education and messaging. And what she has set out to do to address vaccine hesitancy and vaccine readiness is to engage community members to help curate the message, not just focus groups responding to messages, but to help curate what that message should be to help get folks over the hump. So I just want to offer that it really does depend on the messenger. And what I'm realizing from Dr. Irv's work that she's doing is that it might also be a benefit for us to make sure that we help curate those messages in the right way, or get community members to help curate those messages that will go far and wide. But Scott, I would love to know from your perspective, because I know you think about this all day, every day.
Well, thanks today, and it was a great answer. And again, I'll commend all the great work that all of you do as community health workers. A great respect, and most important in where we are today, with trust being as close as possible to people within your community and amongst your community to come up with the right answers. I have hesitated to use the word vaccine hesitance. We always have been talking about vaccine confidence. How do we build that? But we've had, unfortunately, bad communication, if I can say that, for well over the last year. Not anybody's finger to point at, shall we say, but everybody is in this together. Not long ago, I was out. And part of it is even when we talk about breakthrough right now, breakthrough infections, if people understood what vaccines were supposed to do, we would be able to even frame breakthrough differently, what fully vaccinated means. So I think we need to figure out what Janae said, what will resonate amongst the community, and it is different. And when we've been looking at this over time, early on, everybody thought it would be, it's your duty to your friends and family, or you want to get back to things that you were doing before the pandemic, or that it's a patriotic duty. We've heard that at all different levels, but that doesn't resonate with everyone. Many would be much more interested in hearing from their clergy, or from their friends, or from their employer that, hey, come back to work. We want everybody to be safe at work, and we want our customers back, or we want our world back in that regard as well. So the answer is to this question is seemingly simple, is it's complex, and the community health effort, and the closest you can get to listen and understand what could be motivating, and have an answer that's tailored in that regard. And we have tried to cut this, if I could say, cut from what is the Hispanic population in an urban area? Are they different than in a rural area? It's not that simple. And I think multiple messages to build confidence and trust in what each of you do each day is, I think, what will end up in the long term making the difference. And in the short term, obviously we want to be data driven, but I always remind people that passion is the mover to action. Reason or data may be the guide to get us there, but it's the passion and the work that each of you do and how you connect with people that will be that kind of mover. And hopefully you could remind people who are unvaccinated that they are putting themselves at risk, and that fear and that localization that they still have a potential problem from COVID seems still to be the motivating piece that are moving people that might be in that vaccine neutral space. But again, it's not a one size fits all. And, I think today laid it out well, and the other, Venus's presentation, as well, suggesting the challenges in Texas and other areas. We need to keep working at multiple levels.
Thanks, Scott. We had another question in the chat, which is, and Venus, I'm going to hand this one to you, although I know anyone can answer it. What is the purpose of the home COVID kits? Do you believe it'll take away from the number of reported COVID cases? And so Venus, you can jump in, and then Scott, Tanae, Kara, Aurora, you all can jump in too.
Well, you want Venus's version? I have been concerned, because at first when I heard this, I thought, okay, first of all, what are they going to do when they get these kids? Actually back up, I wanted to know how they're going, those people in our community, especially in the rural community, how are they going to have access to the internet to go ahead and register and apply to get one of these kits? So that was my first concern. So we tried to do something about that. My second concern is what happens when they get the kit. Is there a training, a step-by-step training? Because that's another thing that I have not seen yet. That is very culturally and linguistically appropriate. I'm very much in favor of all of our training conforming to class standards, but not so not only in some of these agencies' websites, but some of the information that we're getting on infographics, it's not culturally and linguistically appropriate. So of course I am concerned. And I hope that it works. We're rolling up our sleeves and we're doing everything we can. But for those of us in our community, and we've worked with not only advocates from the Latino community, but also the African American community, we're all shaking our heads thinking, oh, here we go. Somebody up there decided what they're going to do to us here without talking to us first. We could have provided some more suggestions and really, those of us that are community-based organizations having bulk supplies, we could have distributed those more evenly, and especially when we're trying to be more health equity conscious, but that's not going to happen. I mean, for what I understand, a lot of the people that were very savvy they're going to get their kits and they're living in very well-to-do areas, fine. But if it wasn't for us here in this area, a lot of the people wouldn't even know that this was available to them. And so we're concerned about that. It's just, we always feel that our Latinx community is an afterthought. And it's because we don't feel like we're right there at the same table as they're having all of these discussions. It's one of these things where they throw this at us to take care of after they've already planned it. So.
Thank you, Venus. I appreciate, I was hoping, yes, you would give your version, and I think your version is many people's version. And, you know, if we can't have candid conversations about health inequities here, and as we're working to support everybody, you know, across the country, then where can we have it? So there's another question in the chat, and I'm open this up to anyone. My guess is, Scott, you probably should take the first try on this one. So the person may have to jump in a second. We'll try to get it in fast. Do we know what the accuracy of these home tests are? And there are a lot of skeptical people because they don't even get them because their cousin's best friend uncle is a nurse and they aren't accurate. So I'd love any, you know, with your MD hat on, Scott, what
Sure.
do you think? And then today, Venus, Kara, what have you been telling people in your own education?
Well, thanks, Alex. I mean, first of all, the idea of testing, we should have been able to have done this earlier. So if I could say that other countries have made tests much more accessible. In many cases, of course, their systems are smaller and they're public. So the cost was not as much of a barrier. And they frankly also had the ability to normalize it. So someone would go take a test before they would go see friends or go to church or whatever it might be. But now we're behind in the US. The tests are frankly, if I can say without saying a number, right, are good enough. They're not perfect, but the sensitivity, meaning the ability to detect virus or an infection is good enough to hopefully get people still to remember not to interact if they do test positive. And if they have tested positive, to test a second time, even after 5 days. I think we need to go beyond the current, you know, CDC recommendation to see if they are still positive in a way that they could be shedding virus and infecting others. So I think once the tests are out there and we normalize the ability to use them and what it means and how one can change their personal life, I think that is a good thing. I think Venus is absolutely right. We should have had, you know, more engagement with the community. And if I've purchased some of these tests, they're not easy to understand. Even if I have my glasses on or not, because even you know, all the parts of clear communication are not necessarily there. So you know, I'm hoping as these come to your community, and they will be distributed via the Postal Service. I know we don't have equity with everybody having access to the internet or phones or what have you, but those who do get it, we can create unique ways, whether it's even a little simple YouTube video that you do with your friends or family, or go through it. There might not be the great one that they're able to get from a TikTok or CDC group, but to remind people that testing is part of how we're going to get out of COVID, to know that if we are positive or have symptoms, that we should not be infecting others. And that's also the only way that we're going to get away from having another variant, by getting less of this virus circulating in our world right now. So I'm a proponent certainly of the home tests. You know, there are PCR tests and there are other ones that you can get that are lab mediated, but I think the more we just have people normalizing testing and knowing what to do themselves will be the answer, and hopefully change the trajectory of the pandemic.
Thanks, Scott. Today, do you want last word on this? And then Kara, I don't know if you all have resources about the testing that you could drop in specifically yet, but if you do, that'd be great too. Today, jump in.
Thank you, Alex. So to answer the question in the chat, yes, the rapid tests at home will take away from the numbers, because I think fewer people will go get the PCR tests if they're available. I know that's going to happen here in Nashville, in Tennessee. And when that happens, I know the messaging around it, the sort of the political messaging is going to be our numbers are dropping. And so I'm concerned about that, but I'm also concerned, and Venus, you mentioned this also, and Scott, when you said they're good enough, this is my take, is that we still don't know the best strategy for using them. I think every household, every person sort of has a different scenario. And so I would love to have really clear guidance to be able to communicate that with individuals. And testing does not mean that we ignore masks, right? And so masks are still really, really huge. We're lucky in our school district here in Nashville to have masks required, but in the next county over, they're not. In most of the counties, they're not. So I think it's testing and masks and social distancing, all of those messages have to be glued together, and the vaccine, in order for us to have a path forward.
Thanks, Janae. Kara, did you want to jump in or?
Sure, and I am so this is a resource in the chat that's not specifically about testing, but it's more how you think about doing any in-person or outreach work right now, considering the situation with Omicron. And so it sort of covers some of what Tanae's talking about, that like we have to be pursuing a whole suite of protections and safety measures. And I think that's, I would just reinforce what others have said, that we do feel like testing is important and that we've been a little bit behind, but the vaccines continue to provide protection as well as do masks. And so, we will continue to promote and do outreach around vaccinations.
Thanks, Kara. So I know we're about to be over with time. I think the other thing we'd want to add is we want to hear from you. The Vaccine Equity Cooperative, NACHW, Made to Save. All of us are looking for what resources you need, so then we can both find them and advocate for them and better support you. I know this is what Venus is building every day through DML. So this shouldn't be the end of a conversation, but the beginning of a conversation, and we can give all of our contact information out too, and really want to hear from you. Thank you, Tanae, Kara, Scott, Venus. Deeply appreciate your work, deeply appreciate you taking time to do this. And just a lot of appreciation for everyone on the phone. I know we're all so tired of Zoom and doing the best we can. Just know that you are appreciated, and the work you're doing is deeply appreciated. I hope we get to see each other again. I'll hand it off to, I think, Andrea to close us out.
Yes. Thank you so much, Alexandra. And again, all of the panelists, what a dynamic conversation. So rich with resources and information that we can all use as we continue this work. As we wrap up, very shortly, a satisfaction poll will pop up. Please complete that. That is so helpful for us as we continue to host these training webinars. In the wrap-up slide, you will see a reference to both the February and March training opportunities. Those do take place on the third Thursday of each month at 1:30 p.m. Eastern Standard Time. Also, as it was mentioned at the beginning of the webinar that Envision is hiring. Please look for updates on positions that are currently posted and will be posted soon. Right now, there is an open post for the position that will support the Community Health Worker Council. And so we look forward to getting lots of great applicants for that. Also, please make sure that if you have not yet, that you do opt in to the Envision listserv to stay updated on resources and upcoming training opportunities and collaborative opportunities. We want to make sure that you and your partners are continuously engaged in this work. And finally, I definitely have to thank NACHW, the Vaccine Equity Cooperative, and the CDC for such a dynamic webinar today. And also thank you all so much for spending your time here. We look forward to continuing this work together. And with that, we will officially wrap up today's webinar.